Hi class. Today we're on chapter 6, how to interpret a rhythm strip. The 5 steps to interpreting a rhythm strip are: number 1, look at the rhythm and determine whether it's regular or irregular. Number 2, you're going to determine the heart rate, and that's going to be your beats per minute. Number 3, examine the P waves, and you're looking to see if the P waves are present and if you have one before each QRS. Your PR interval, you're going to check its measurements and make sure it is 0.12 seconds to 0.20 seconds and not below or above that. And the measurements of your QR complex should be less than 0.12 seconds. So let's look at the rhythm strip below and let's run through those 5 steps. So we're going to look and check to see if for our P waves, and we see here. Okay, so our P waves are present. Now we're going to look for our QRS to see if there is a P wave before every QRS. And we see here. Okay. Are the P waves in the QRS complex regular? And so we're looking here. And they are coming regular. Is the PR interval constant? And it is. So here, this is an example of a normal sinus rhythm. Here's another example. Look at your heart rate. Check your rhythm regularity. Look for your P waves. Make sure there's one before each QRS. And check your measurements for your PR interval and your QRS. Okay, so remember your P wave represents your atrial depolarization. And let me just point something out to you guys. The way they're getting the numbers, in case you're not sure, okay, the 0.12 and the 0.20 is each of the small blocks is equal to 0.4 seconds, okay? So if you have 5 small blocks in between, then you'll multiply 5 times the 0.4, and that will give you your 0.20. Okay, so the PR segment is conduction delay through the AV node, and it's used as a baseline to evaluate the ST segment elevation or depression. Your PR interval is your atrial depolarization plus the conduction delay through the AV node. And your QRS is your ventricular depolarization. Your ST segment is your isoelectric, but the ventricle still depolarized. Your QT interval, ventricular depolarization plus ventricular repolarization. And it's the mechanical contraction of the ventricles. And then you have your T wave, ventricular repolarization. Okay, so to determining your normal sinus rhythm, here we see the rhythm is regular. There's about equal space from R to R. And of course, you'll count your small blocks in between each when you're looking for your regularity. Your rate is 60 to 100 beats per minute. The P waves are upright and they're uniform. They all look alike. And then we have one before each of our QRS complex. Our PR interval is between the 0.12 and 0.20 seconds, and it's constant. And then we have a narrow QRS, and it could be wide sometimes too, but your QRS should not exceed more than one or two blocks, one or two small blocks. Okay, so we looked at the normal sinus rhythm. So let's talk about arrhythmias. An arrhythmia is an abnormality of rate, regularity, or site of origin of the cardiac impulse, or a disturbance in conduction that causes an abnormal sequence of activation. So with arrhythmias, you're going to have an irregular rhythm, abnormal heart rate, and conduction abnormalities. Your criteria for arrhythmias, your QRS complexes that are absent or abnormally shaped, your P waves that are absent, multiple in number, or abnormally shaped, abnormally prolonged or abnormally short PR intervals, abnormally prolonged QRS intervals, and or the heart rate is abnormally slow or fast, or the rate is irregular rhythm, or rhythm that has interruptions by premature beats or pauses. So look at our two hearts here, one showing an illustration of a normal beating heart, and look at the difference with the arrhythmia. Okay, so here's just a little mnemonic to help you guys remember the order of the PQRST. And it says P is for the pain required to learn EKGs. Q is for how quickly these facts disappear from my brain. R is for how ridiculously awesome a heartbeat is. S is for searching textbooks for answers. And T is for always trying to decode the rhythm. Okay, so for your assignment, I want you to create your reference card or reference sheet if you don't have any index cards of table 6-1 on page 68, your criteria for a sinus rhythm, and then table 6-2, your criteria for arrhythmia. And that's all I have for you guys today. I will see you next lecture.